the vision for healthcare is health promotion. I remember growing up, you hear parents say this kind of thing that let him eat the sand. Because so you see, telling people wash your hand, clean yourself properly when you use the toilet, all those things, it stresses them out.
Hygiene. Do you now want to say that the hospital facilities are not properly kept?
It's not properly remunerated. I mean, in terms of finance, that shouldn't stop you from doing your work.
Kudos to every cleaners out there making our hospital facility look like you guys are doing an amazing job.
When they see the environment, they're like, oh wow, this place is neat.
It's neat.
It shouldn't be a surprise that an hospital is neat.
But I think
that's something that in the healthcare profession we are trying to eradicate. When people that don't know anything about the profession, they are the ones there. A patient should know his or her rights. When you see that things are not done properly for you, you have a right to sue the healthcare worker.
How do we even know they are not properly done?
Exactly. That is why we're having podcasts like this.
Exactly.
That's what
I think that should be the take-home note. Wash and wash again. Welcome to sHealthPodcast, your best bet on health-related tips and hygiene. And trust me, today is another exciting moment on the show. You know how we do it. I am Debbie Mike, and today I am not alone in the studio. I feel so excited because I have an amazing person. You know how you feel when a man is in the house. You feel protected. You feel you can do anything. You feel you can jump up and down. That's how I feel right now. He's an amazing person with an amazing name, actually. And I think I would want to know the reason behind his name in the course of the show. So, guys, drum rolls for our guest, Nurse Oluwakemi. Good to have you on the show. Good morning.
Thank you so much. Good morning.
Okay, so let's start with your name, Oluwakemi. Actually, with my little experience, I know Oluwakemi is a feminine name. So why the name?
Well, for me, my name is a very good conversation starter.
Okay.
I mean, anybody I want to talk to, I just start with my name and they're like, oh, what happened?
Exactly, the same way I'm feeling.
And then I'm like, well, one funny joke I used to crack, which I don't think is funny, is that my dad is feminine.
Oh, okay.
So just sometimes if I don't want to answer the question, I just say that. And people are like, oh, what's that? And I'm like, well, I think you should ask my dad.
Okay, that's really an amazing
I'm not sure. He probably changed his name or something. You know how the Southwesterners are.
That's really an interesting name. Good to have you once again. How do you feel being on the podcast today?
Well, I feel very excited. I'm very happy to be here, and SRHIN is really doing a great job.
Yes.
The projects that I've seen them take, and this podcast is one that I'm sure that would enlighten a lot of people. So I'm really excited about that. Yes, thank you.
You're welcome. Thank you. So today we are going to be looking at hospital-acquired infections. Hospital-acquired infection. These are things that so many persons out there do not take cognizance of, and at the long run, you see them having to deal with various infections. So, what are hospital-acquired infection?
Okay, so hospital-acquired infection, as the name implies, is as simple as that. Infections that are acquired from the hospital environment during the care of the patients. Okay,
sorry, but that is really going to spark a lot of questions in the heart of people, because I'm going to the hospital to actually treat myself, and you're saying there are hospital-acquired infections. Like how?
Yes. Well, when I was actually learning nursing, that's something I questioned as well. And the simple answer to that is that just tells you that nowhere is neat, nowhere is clean, and we all should just take care of our health. I mean, the responsibilities to us first, to the mothers, to the children, to the dads, before you now start saying, okay, let's bring them to the hospital. Because even in the hospital, well, as nurses, we try to involve the patients in their own care. So we are not like doing everything for them. We try to do the major things for them, and then so that when they get home, they can continue that practice. Because you realize that many of the patients, there's a life they used to live when they were at home, and when they come to the hospital, they just want to live that kind of life.
And because they feel that it's safe, I'm in the hospital, I'm in a
hospital, you know, the nurses will take care of me,
exactly.
The cleaners will come to clean the place. But that within that period of the cleaners coming and the hospital management coming around, you might have just come in contact with an infection due to your act. So yes, that's one of the ways that hospital acquired infections are gotten.
Wow, that's an interesting one. So would you mind sharing with us some examples of this hospital acquired infection? Is it that I could go to the hospital and get contracted with malaria, or just some examples?
Okay. So there's one that is quite strong. I don't want to use the word strong now, but like it's very, very repellent to antibiotics.
Okay.
We call it methicillin resistant Streptococcus aureus. It's a form of bacteria.
Okay.
And from the methicillin is an antibiotic.
Okay.
So it is resistant to that antibiotics. And it is very common. It's one of the most common form of nosocomial infection.
Okay.
What I mean by nosocomial infection is hospital acquired infection.
Okay.
So and the fact that it is resistant to methicillin, and many of the antibiotics we have around is actually based on methicillin. So one thing that we the health workers do is that we will consult with the microbiologist before we even go on treatment at all. Which kind of infection is this? That's one of the most common ones, and I'm saying that because it is very difficult, and when we are considering mothers and children, when we are considering neonates, it kills fast.
And these things are acquired in the hospital?
Yes, and it is acquired in the hospital. Of course, you can acquire it outside, but it is even more acquired in the hospital. Okay. Another one in the virus category is the norovirus.
Okay.
And this one, well, it affects the gastrointestinal region. When you see a patient that came in for a surgery, a child that was just giving birth to, and you are seeing the child dehydrated, the child is stooling, you just want to question, is this a norovirus? Is this something that we have to pay attention to?
Okay.
Yeah, so there's that. And one funny thing about this infection is that, especially for mothers and children that we are considering, for babies, for neonates, their immunity is low. Their immunity is very low. So you want to protect them as much as possible. You want to prevent the infection as much as possible, because when you have a group of babies that are in a ward, in no time, once a baby comes down with the infection, you just see that in no time all the babies in the ward comes down with that same infection, and the mortality rate for neonates is very, very high due to their low immune system. So.
All right, thank you so much for that. So beyond that, I want us to narrow it down to some minor ones that we might not pay attention to, like some urinary tract infection, some surgical site infections, and maybe pneumonia. So I don't know if you could break this down for us. Okay,
so while we are talking about these infections, you are already saying the infections, UTIs, gastrointestinal, pneumonia, all these kind of infections. They have
even bloodstream infections.
Yes, bloodstream infections. They usually have their causative agents, and one that is very common with the UTI is Escherichia coli.
Okay.
And as I have said, the management is such that you have to consult with a microbiologist because fine, this is a nosocomial infection, and how an infection is nosocomial is that not just one patient has this infection. So, for instance, UTI can be transmitted through the use of bedpan. When a patient uses a bedpan, a patient that cannot mobilize easily, you give the patient a bedpan, and then the patient uses it. Then you go and wash it. There's a proper way to wash. There's a proper way for even the patient to use. When a patient in the ward wants to use a bedpan, they are supposed to pour some solutions like soapy solution, Izal, before they use. So that way the infection spread is reduced. So for instance, a patient that already has a UTI, Escherichia coli is the causative agent, and he uses the toilet or he uses the bedpan, for instance, and you use that same bedpan, you didn't clean it properly, or you cleaned it, but these bacteria, they don't die easily.
That's
so
true.
You have to, and then another patient wants to use it, so you just see that the spread is consistent. Do you get? So you just see that everybody in the world is complaining of UTI.
Okay.
Yeah, so.
All right. So thank you very much for that wonderful one. Okay, now I would like us to narrow it down to Bingpe that will always go to the hospital with their little kids, and then when you go to the hospital with little Bingpe, and then Bingpe is playing with toy, the toys fall off, and then you just pick it and then dust it maybe on your clothes. These are some of the things people like Bingpe actually do, and then you return the toy back to your baby. These things also can they be some causes of hospital-acquired infection to the child or even to the mother?
Yes. When we're talking about mother and child, for instance, the Bingpe that you said.
Yes,
now,
so Bingpe.
Many mothers want to, they want their children to stop crying.
Yeah, that's true. That's true.
So anything the child wants, they give. Let's even come from the aspect of, okay, when they are selling something around the hospital, you don't know where these things are being made. You don't know the source, the water they use to produce these things.
That's
you
true.
don't know how clean their materials are. And as I have said earlier, the immunity of any child is way lower. They are still developing.
Yeah.
So everything about them is developing. So when you buy anything they want for them that is not properly sealed, or that is not properly processed, or you don't even trust, then they can come down with this infection. Another one is what you have said about the picking up of the
toys, because I would say that is very common. It's something I see very well. Aside from even the hospitals, even generally, these are things that happen, and I've seen that in the hospitals too as well. So I don't know what can be really done. I don't know. Some sort of advocacy or something really needs to be done, but I think we would come back to that. But aside from mothers and even their children, even the normal patients that just maybe walking for maybe some treatments or some consultation and stuff like that, they might have a napkin. Maybe someone is with a napkin and then it fall off, and then you just pick it and then still use it to dab your face. Yes. These things are the things we also need to take cognizance of.
Yes, that's why we say in medicine and in public health, which I'm an expert of, prevention is way better than cure. Okay. We want to promote your health. We want to see that you are doing the right things that don't even bring you to the hospital at all. So it's important.
But wait, if you are saying we don't come to the hospital at all, how do you expect the nurses, the doctors, and all of them to actually survive if there is nobody in the hospital?
Actually, yes, that is one notion that I personally want to change, especially in the in Africa here.
Okay.
You feel like doctors or nurses would gain, or they are happy when the patients come to the hospital.
But that is how they make money.
No, that's why the vision for healthcare is health promotion. When I say health promotion, we want you to come to the hospital because you feel like, okay, you want to take care of your health. You are obese and you want to reduce. You don't have hypertension yet. You don't have diabetes yet.
Okay,
that's
you
why
want
you're
to
coming
prevent
to the hospital.
Yeah.
Yes, you want to prevent. It's easier for us and we are happier because.
And do you think you guys are really going to still make money? Because this money, I really want to. Well, I don't want to believe.
Well, money will be made. Trust me, money will be made, and that's why there's innovation.
Yeah, that's
innovation to healthcare. You want to make your patients. You want to make the world better. So you should not pride in having sick patients. So health promotion is way important than now treating a patient that has come down with a diagnosis.
Yeah.
And fine, okay, the population will be reduced, but there are many more interventions that would now come up in place of the treatments. Better ways to promote the health of a patient, and that will bring the money that everybody's clamoring.
Okay. That's an amazing one. So now, I don't know if you could share some stories, as an expert in this field. Have you seen any scenario of hospital-acquired infection you could share?
Okay, so as an expert, as a nurse, which I'm proud of, we are the first line of contact with these patients.
Yeah.
We are with them all the time, so we can almost say, this patient is, when a patient, for instance, I worked at an hospital where you have a patient that came for a surgery, maybe an appendectomy or something like that, and then the patient is complaining of high fever. Patient is complaining of high fever, and that means something has happened in the course of the operation surgery that was done, maybe, or the management. Then the patient came down with an infection. That's simply a nosocomial infection, because the patient didn't come complaining about
high fever
or an infection, but because of the course of the treatment, because of the environment or the management of that surgical site, the patient came down with that kind of infection. So that's why it's important for healthcare workers, both healthcare workers and patients have a role to play in this prevention that we are talking about, in this hygiene we are talking about. For a patient like that came for a surgery, we have to dress the wound regularly. And you notice that some of these patients, they don't have the dressing pack that they need. Because of the situation of Nigeria now, things are bad, in a system that works, in a system that really works. The hospital is supposed to provide all the packs that the patient needs to treat this wound before they leave. Where a patient is supposed to be dressed daily, you want to dress the patient 2 times in a week. It can be that terrible in some settings. So things like that would definitely prone a patient to infection. And then another experience is, I worked at an hospital where we take care of babies that were born prematurely, and they are born prematurely because they were not taken up to term. Maybe something happened to the mother along the way, and the baby just had to come out. So these babies, their immunity is very low. In fact, they are still developing. So there's this machine that we use to nurture them for the time being before they are taken home, called an incubator. So in that setting, the environment should be kept sterile. Every equipment that you're using for the baby should be kept sterile.
Let me cut you there for a while. So I think this conversation will take us to the causes. Like, what are those things we really do not pay attention to that actually breed some of these infections? But before then, I actually glanced through a statistics that says 1 out of 31 persons that goes to the hospital gets contracted with this hospital-acquired infections. How true is that? Or what would you say?
Well, statistics are changing. The trend is changing, and depending on how much we try to prevent these things, it affects the statistics ultimately. According to the statistics, you said 1 out of 30. So imagine we have 30 patients, and 1 out of every 30 patients that comes to the ward. So
it means that even the other 30 are not safe any longer.
Yes, the other 29, they are not safe. I mean, when one person comes down with the infection, and God will have it, the infection is now easily transmissible, fecal oral routes, indirect contacts.
So they are not being exposed.
They are ultimately being exposed, depending on the amount of days that they spend in the hospital.
All right. So now that we have been able to see that we can be exposed as patients to the hospital-acquired infections, I don't want to say, we don't pray to fall sick. We don't pray for that. So that is why we really need to be careful, right?
Yes.
But then I want to say that what are really the causes? Because I'm sure Iyabimpe don't want to go to the hospital and discover that the baby you are taking for immunization is getting infected, actually. So what are the causes, so that being watching us out there, we be very careful?
Okay, well, one of the causes is poor hygiene in the hospital.
Like, I don't know, but I kind of think that this hygiene thing is really key. Like, it's the number one when it comes to health.
Yes, it is key, but a lot of people don't pay attention to it. I mean,
like, we just really commonize hygiene.
Yes.
We just look at it as take your bath, brush your teeth, eat food and fruits, and
yeah. And another thing is, I remember growing up.
Okay.
You hear parents say this kind of thing that let him eat the sand.
Yes,
I don't know if our listeners
that's true. Yes,
let him eat the sand. That's how we used to grow.
Yes. Like, for people that don't understand Yoruba, actually,
sorry,
get an interpreter. But then we are saying that when children grow up, you can maybe something can just fall off from us, and then we pick it up, and our parents are like, yeah, kid, eat the stone, kind of a thing. That sickness cannot kill a black man, those something kind of like ideologies. So, and I want to say, I think we've tend to grow up with those ideologies, and it's really affecting. And then trying to tell someone you need to pay attention. Imagine telling a grown-up man that you must always wash your hands. It
stresses them out.
Yeah.
Imagine this COVID time when everybody had to use.
You are even going far, my brother. The cholera thing.
Oh, the cholera thing.
Like, because
so you see, telling people wash your hand, clean yourself properly when you use the toilet, all those things, it stresses them out. They're like, why is this happening?
Exactly.
And there's one funny part of it where people feel like these diseases that come up, they are limited to those in the foreign countries.
And they are white men diseases.
Yes, they are white men diseases and stuff like that. So these diseases are no longer white men diseases, because even blacks are going there and coming back. So everybody has basically mixed. Let's come to the fact.
Yes, that's true.
Let's just face the reality and take care of our health, basically.
So the hygiene is
hospital hygiene, personal hygiene as well.
But okay, now on the part of the hygiene, I want to say that, okay, you're saying hygiene. Do you now want to say that the hospital facilities are not properly kept for us to still pay attention to our hygiene? I'm asking these questions on behalf of the listeners that might want to ask.
Okay, so that's the situation that
because I feel I'm going to the hospital, I'm safe. So why do I pay attention? That's the
situation that we find ourselves in the world, and each healthcare expert should see themselves as playing a key role in helping the patient and taking care of the patients. You cannot say the doctors are the one in charge of the hospitals, then it is left to them. You cannot say, the nurses are the one in charge of the parents and they have to be liable. They have to be responsible for the health of the patient. To the simile list, which people feel like they don't matter in the healthcare setting, the cleaners, they are very, very important.
Exactly.
I mean, they are very,
That's
very important.
True. I was trying to come to that. Like, the cleaners, they are people that we kind of underestimate their roles, their duties, and all of that.
I would like to say something. That I want our listeners, watchers to pay attention to, because a person is not properly remunerated. I mean, in terms of finance, that shouldn't stop you from doing your work, because especially in the healthcare setting, I used to remember they say, aviators, people that pilots, they are paid more because their job is a dying affair or something like that. The same thing applies to the healthcare profession. You are taking care of lives. I mean, lives are in your hands. To the list of the healthcare professionals, the cleaners, I don't like to call them cleaners because they are very important.
Of course they are. And I would say kudos to every cleaners out there making our hospital facility look like you guys are doing an amazing job, and we recognize that.
When some people get to the hospital, some patients, some clients get to the hospital, when they see the environment, they're like, oh wow, this place is neat.
It's neat.
It shouldn't be a surprise that an hospital is neat.
But I think I've noticed that actually.
An hospital should be neat all the time, like,
because I think a couple of times I've actually commended some hospitals.
So
actually,
the hospital should be a place where a patient comes and is comfortable, much sometimes even more comfortable than home.
Nurse.
Yes. So you as the nurse, you as the healthcare assistant should ensure that this is something they do abroad and you don't see in Nigeria. It's really not about the money you're getting from it. It's just about your passion for the work.
And then being diligent.
So you see, that's something that in the healthcare profession we are trying to eradicate. When people that don't know anything about the profession, they are the ones there. They are trained healthcare assistants. They are trained nurses. It can be so funny that there are some doctors that are not even trained and they don't have the license to practice that are practicing. So, all this wealth of knowledge that we have as licensed officers, they don't have it. So they don't even know what best to do. So many of the hospitals that people go to, or people feel that they don't have to pay much to go to, they are killing the patients because they don't have the proper staff, they don't have the licensed staff that have the understanding of these things.
That's true.
Your level of intervention is based on your level of knowledge.
Okay.
Yes.
I would like us now to step up a bit to the preventive measures that we can take to prevent this infections.
Okay.
Now that I think from our conversation, we would say that hygiene is one part of it that one really, really needs to pay attention to. That could be the causes of hospital-acquired infections.
Yes.
So now going to the preventions, I would like to say that now we spoke about how important the healthcare cleaners, how important they are and what they do really matter. So now, let's start with, are there some sort of advocacy or some sort of training they give before we dive into the prevention they give to these cleaners to help them diligently do their job, or they perceive that, okay, you're a cleaner, your job is to clean, sweep, mop, clean the surface and stuff like that? Are there some sort of measures?
So as of now, I'm not sure if there's a certification for them, but I feel the hospital that is bringing them in, that is employing them, should do a part-time training for them on the care of the patient, because trends are changing.
Exactly.
And that's why there's what we call research in its sense, where they are new developing. For instance, now since COVID, I'm sure there have been some certain things that have been put in place by some certain hospitals that have continued since then.
Yes, and I think the hand washing part is something we need to commend. Yeah,
exactly. So, for instance, the hand washing, there's a proper way to wash the hand.
Exactly.
Some people just go to the tap and like, something.
Okay, like so for Iyabingbe,
yes,
I think Iyabingbe has really suffered this morning. So for Iyabingbe, like this hand washing, how, like you're saying there are ways to it.
Yes.
So, because I'm sure Iyabingbe is someone that will just put water and then I've washed now. Isn't that the right approach?
I don't know if I should teach.
Okay, please
wash the hand. So when you're washing the hand, you are paying attention to every aspect of your hand.
Okay.
Because these bacteria, these infections are in units. Anywhere can be infected. So when you are washing your hand, the purpose of washing is to ensure that every part of the hand is covered. So there is a technique to washing the hand. So I don't know if you can join me to perform this.
Okay.
So can you just raise up? How do we do it now? Okay. When you're washing, you first wet your hand with water, right?
Okay.
You wet with water and then you put soap.
Okay.
Enough soap to make it soapy.
Okay.
So now you rub your hand like this.
All right.
Then you rub. Interlock the back.
Okay.
You see, when you're washing this way, you are already washing inside. Can you see?
Yeah,
you're washing
that's
inside.
True.
Then you come again like this. Then after that, you can wash this.
Yeah.
You wash the thumb, then you wash your fingernails like this. Then when you are done, you wash your wrist.
Okay.
Because you see that way, every part of the hand, you don't pay attention to the wrist.
Yeah.
So when you've done that, then you can now rinse. Now when you are rinsing, you rinse appropriately, such that you are rinsing from the. Don't let me use complex grammar.
Okay.
From where you know that you don't usually use too much to the place where you use.
Okay, that's so you can start from the wrist.
Yes, and then it goes down. Do you get?
Okay.
So it goes down. Then when you are done rinsing, you can just dap your hand with the cloth, and yes, you're done with cleaning your hands.
Wow, so that's an interesting one. So Bimpe, I hope you've been able to learn how to properly wash your hand, because it's very important. So going back to the preventions, so I would like to hear from you, what are the preventions, what are the preventive measures that as patients we should take, and then as healthcare workers, because I think it's from both ends. It's not only it doesn't only lies in the hands of the patients.
Yes.
So
another thing aside from the hygiene is, as a human being, you have to know your right.
Okay.
As a patient, as a person, you have to know your rights. For every institute you go into, there is a right. You have a patient. There's what we call the patient's bill of rights. So you have your rights, and we nurses, well, I'm a nurse advocate, so you have to be able to advocate for your patients when things are not being done properly for them. You ask that things be done. So when you see that, for instance, now I would like to use sterilization of equipment.
That's true, because we just go and we feel this person is a nurse, this person is a doctor, she can inject me.
A patient should know his or her rights. When you see that things are not done properly for you, you have a right to sue the healthcare worker.
How do we even know they are not properly done?
Exactly. That is why we're having podcasts like this.
Exactly.
That's why we have conversations like this, where you should listen and you should know that, okay, these are the things that I should know. So for instance, when you have a dressing pack and the nurse or whoever is going to do the dressing for you is coming with the dressing pack opened,
without even gloves?
Without gloves. I mean, the dressing pack should not even be opened at all. It should be sealed until the healthcare worker is at your bedside. And there's a setting, you have to have a sterile tray, whatever setting you are using. And another issue concerning that part is things are now very funny in Nigeria, as I have said earlier. You know, improvisation here and there. When you are supposed to be using a trolley, a proper trolley for the care of a patient, you are just using a tray.
I've seen people even come to the patients with the syringe and needles
just like
in
that,
their hands.
Yes.
And then they just inject.
You know, improvisation, and that is not proper for you. If you know your right, if you know your right and you express it as a patient, the healthcare workers are going to immediately start doing the right thing, and they're like, oh, this person. They are not going to say you are doing too much, because it's your health, and your health is your wealth. I mean, so why would you come to an healthcare setting and then you're going back with an infection? In fact, when you get to an hospital, and an hospital should ask when you are being discharged, that what are your remarks about the hospital? Did you take care? Just like, you know, you go to an hotel, or even
you use some social media applications, and you have to rate them.
An hospital should be able to say that, oh, how would you rate our service? Because it's a service. So they should be able to ask, and then you are giving them good remarks. And if there's a negative remark, they should take it with love and do better. That way the healthcare system is better. We are taking care of people, and we are working on the promoting of the health rather than.
Okay, and then for the patients that actually go in as well, what are the personal preventive measures they should take cognizance of beyond, like, I don't know, can you a bit of the hygiene for them?
Okay,
because
for them.
We've spoken about the healthcare workers now.
Yes, so for the patients, what I'm going to say concerning the patient is, whenever you have an healthcare worker that is telling you to do something, try to do it. It's not that they know better than you. Imagine I am going to
they actually know better in that life.
Yes, exactly. So we know better than you, and we are not just going to come to you telling you to do something that we're not going to explain. So we explain to you why you should do it, and I feel patients should listen to the healthcare workers. Listen to the healthcare workers. You know, there are two sides of a coin now. You know, you can have a patient who actually knows his right, but you're not able to express it well. And you're just being rude, nonchalant to a nurse because the person is a nurse. So there are ways to express how you feel.
All right.
So that way, even the care is even better. So, and then another thing is, take care of your personal space. I mean, when you are admitted to a bed ensure that your trolley is clean. Ensure that what you're eating is clean. Wash and wash again.
Wash and wash.
Wash and wash again. If you're taking a fruit that has been dropped on the trolley, infections are spread through the air. So when you want to pick it up, don't just pick it up and eat.
Consume.
Wash and wash again. When you are done eating, you wash again.
I think that should be the take home note.
Yes.
Wash and wash again.
Because when you wash, it's better. You're not eating. Though there are some infections that cannot be stopped by washing, but I feel like when you wash, it
really helps a lot.
Really helps. Yes.
Okay. So above all, in just few seconds, what are your final words?
Well, I'm very excited to be here.
Okay.
And my ambition is that, or my hope is that Nigeria becomes better. Because a better Nigeria is a better healthcare system. And the situation, the protests is very, very serious, and even the healthcare workers are feeling it. The patients are feeling it. You know, when you go to an hospital now, the situation is terrible. I mean, very terrible, and may God help us. Yes, so that's my parting word. God bless Nigeria.
So guys, I hope you've been able to learn and unlearn. And like I said, my take home note from this podcast is wash and wash again. So please imbibe in you the act of washing. Hand washing is key. For healthcare workers, hand washing is key. For everyone in the hospital facilities, as you're entering the hospitals, ensure that you wash. Before you consume anything, ensure that you wash. And for mothers who go to the hospital with their kids, maybe in the course of immunizations and stuff like that, ensure that you wash your baby's hand, wash them. And even when they play with some toys and it falls off, try to wash those toys, or better still, you keep them if you cannot access or go out to wash immediately, so that the child do not get contracted with infections immediately. So guys, wash and wash again. This is very important. Do not joke with your hygiene. Your hygiene is key. It is paramount. So to you, nurse, thank you so much. I think I want to give you this name, Wash and Wash Again. Thank you so much for joining us on the show. I look forward to having you subsequently. Thank you so much.
Yeah, thank you. It's been a pleasure as well.
All right. So guys, thank you so much for watching this podcast. Thank you so much for listening. Thank you for your time. Don't forget to like, comment and share, and don't forget to also click on the subscription button so that whenever we have a new episode, you are always number one to get the notification. I'll see you in the next episode. Bye bye. Don't forget to wash and wash
Again.